This video we are going to start with ANS, Autonomic Nervous System. So starting with this, hypothalamus is the highest seat of ANS regulating functions. In hypothalamus, the posterior and lateral nuclei manage the sympathetic system, and anterior and medial nuclei manage the parasympathetic system. Okay. Now in this, also remember the autonomic centers in brain which control the pupillary, the vagal and the respiratory functions are located in midbrain and medulla. Okay. Now in this, remember the lateral columns. These are the cells which manage the sympathetic outflow. So sympathetic, you will see it is basically managed by the thoracolumbar region of the spinal cord. Parasympathetic system is managed by cranial nerves, or it is inside the cranial nerves. Which cranial nerves? 3, 7, 9 and 10, and sacral nerves, right? Moving on further, there's something that you should know about sympathetic system, that here the ganglion is away from the organ, and so the postganglionic fibers are very long. Then the parasympathetic system, here the ganglion is close to the organ, or it is in fact present on the organ, and so preganglionic fibers are usually longer. Okay. Now acetylcholine is the principal neurotransmitter at all, remember this, at all preganglionic fibers. Okay. And also at neuromuscular junction, right? Now in parasympathetic, postganglionic fibers also release ACH, that is acetylcholine. In sympathetic fibers, postganglionic fibers release noradrenaline. They also release dopamine, where? In renal and mesenteric vessels. They release adrenaline at medulla, and they release acetylcholine at sweat glands. Okay. Now let's see the actions of parasympathetic versus sympathetic. So now in this, सबसे पहला जो action है heart पे, this is a very gross या at a simpler level understanding of action. Heart पे sympathetic will always increase the contraction while parasympathetic decreases. Okay. Rest all parasympathetic increases, sympathetic decreases. कैसे? जैसे ब्रोंकस पे देखते हैं. ब्रोंकस पे sympathetic क्या करता है? डायलेट करता है, और पैरासिम्पैथेटिक कॉन्स्ट्रिक्ट करता है, राइट? जीआईटी में क्या करता है? सिंपैथेटिक जो है रिलैक्स करता है बॉल को, ये कॉन्ट्रैक्ट करता है एंड इंक्रीज पेरिस्टाल्सिस, राइट? देन यूरिन, सिंपैथेटिक क्या करता है? रिटेंशन कराता है, और ये वो फ्लो कराता है, मतलब यूरिन रिटेंशन को रिलीव करता है, राइट? सो हाउ डू आई राइट इट? रिलीव्स रिटेंशन. देन प्यूपिल, दिस causes mydriasis. This causes meiosis by parasympathetic. Secretions, parasympathetic reduces all the secretions except sweating. Okay. Sympathetic increase secretions. I think I have written it all ulta. Parasympathetics, they will, I'll have to check it out. Okay. Yes, so actually I was having a confusion. Sympathetics, they decrease the secretions except sweating, right? And parasympathetics, they increase the secretions. तभी तो जब atropine poisoning होती है तो उसमें dry skin, dry mouth हो जाता है, because there is a reduction in the secretions in atropine poisoning. Okay, so these are the general actions. Here you can see that heart, sympathetic will always increase the activity of the heart, while in all the other cases sympathetic is reducing the activity. It is bronchus में dilate कर रही है, GIT में relax कर रही है, urine में retention कर रही है, pupil mydriasis कर रही है, secretions को कम कर रही है. Okay. Another important thing that I want to tell you here are co-transmitters. So here with acetylcholine, we also find that there is a co-transporter. These are normally peptides, VIP, ATP and NO. And with the norepinephrine, we have ATP and neuropeptide Y. So if there's a question that what are the co-transmitters, so you should be able to write this. Then there are some noradrenergic, non-cholinergic transmissions. Okay. Non-adrenergic, non-cholinergic transmissions. So they are mediated by peptides like neuropeptide Y, VIP, substance P and enkephalins. Okay. So So this is non-adrenergic, non-cholinergic transmission. Now let's start with the parasympathetic system. अभी तक हम लोग एक जनरल सा देख रहे थे parasympathetic system. Now parasympathetic system में the principal neurotransmitter is acetylcholine in all pre and post ganglionic fibers, right? So let's see what is the synthesis, storage, release and destruction of this enzyme. Okay, so the first step in the synthesis, storage, release and destruction, how it is formed. Acetyl coenzyme A combines with choline and forms acetylcholine. Okay, this acetylcholine is broken down by the enzyme cholinesterase and then it breaks down into choline plus acetate. Okay, this is the biochemical reaction. Now there's another thing that we would like you to know. Now this is the presynaptic terminal and this is the postsynaptic terminal and here is the acetylcholine receptor. Okay, now this choline is basically taken up into the synaptic presynaptic fiber. This choline combines with acetyl coenzyme A and forms acetylcholine, right? Now this has to first go into a synaptic vesicle and remain stored there. Then it comes and it fuses with the membrane here and it is released, right? Now this acetylcholine then attaches here on the receptor, right? After that, this acetylcholine is then broken down into choline and acetate by the enzyme cholinesterase, and this choline is then taken up by the presynaptic fiber. So this is the cycle. Now let's see where all the blockades happen. So is choline को uptake, the reuptake of choline, this is the presynaptic fiber, the postsynaptic fiber. Here choline is reuptaken into the presynaptic vesicle, presynaptic fiber, combines with acetyl coenzyme A, forms acetylcholine. This goes into the synaptic vesicle and then the synaptic vesicle fuses with the membrane and there is release of acetylcholine which attaches to the receptor. So this is the receptor, okay? And here then again it is broken down by choline esterase into choline and acetate, and this choline is reuptaken. Now this choline reuptake is inhibited by hemibotulinum toxin. Okay, this choline reuptake is inhibited by the hemibotulinum toxin, and remember this choline reuptake is the rate limiting step. So if this is inhibited, then the whole process gets stopped. It's the rate limiting step of this whole reaction. Okay, now another thing, sorry मैंने कुछ इसमें है it is hemicholinium. Okay, so this is hemicholinium which inhibits the reuptake of the choline inside the synaptic fiber. Now another thing, acetylcholine entry into the synaptic vesicle is blocked by a substance which is called as vesamicol. Okay, so this vesamicol inhibits the uptake of acetylcholine into the synaptic vesicle, storage of acetylcholine into the synaptic vesicle. Then release is inhibited by botulinum toxin, and excessive release and depletion is done by black widow spider toxin. Okay, this cholinesterase is inhibited by physostigmine and neostigmine. Okay, so this is a reaction where you have to understand where all the blockers are acting. This is the synthesis. Choline reuptake is blocked by hemicolinium. Acetylcholine uptake into the vesicles is blocked by vesamicol. Cholinesterase is blocked by physostigmine, neostigmine. Release is blocked by botulinum toxin, and excessive release is done by black widow spider toxin. Right? I hope it is clear. So synthesis, storage, and release and destruction of the acetylcholine. Now you have to understand. Just remember, cholinesterase is of two types. One is the acetylcholinesterase and one is butyryl cholinesterase. It is also called as pseudocholinesterase. It basically slowly hydrolyzes acetylcholine, has got different properties from the acetylcholinesterase, right? Coming to the next part. Now the most important part about the cholinergic system is the receptors. Yes, receptors. I just love the receptors. Now receptors of muscarinic system, they are muscarinic M1, M2, M3 and nicotinic NN and NM. Okay, now we'll go through the receptors one by one and please understand them properly. M1 is GQ mediated, M2 is GI mediated, M3 is GQ mediated, NN and NM are both ion channels, right? Okay, M1 mainly present in the stomach, so stomach mein jaake it increases the HCl, so causes acidity, present in CNS and plays a role in learning and memory. Okay, M2 is present on heart, and by having an inhibitory reaction it basically reduces the heart rate and reduces the conductivity. Okay, CNS mein it causes tremors and analgesia, smooth muscles mein it causes contractions. Okay, coming to M3, now this is very important. On bronchus it is present on the smooth muscles, so bronchus mein karata hai contraction. Okay, GIT mein karata hai contraction, so peristalsis. Bladder mein contractions. Okay, so urine outflow. Glands में कराता है secretion. Pupil में कराता है meiosis by contraction of the of sphincter pupillae. Okay, and another very important thing is it is present on the endothelium of blood vessels and causes release of EDRF, which causes vasodilatation, right? So these are the actions of M3 receptor. NN receptor जो होता है गैंग्लिया पे होता है, and गैंग्लिया पे होने से it causes stimulation and release of adrenaline. Okay, NM is present on neuromuscular junction, and there it basically causes contraction of the neuromuscular end plate, right? So these are the various actions of acetylcholine which are mediated by their various receptors. I've told you the transducer mechanism, the location of these receptors, main locations, and their main actions which are mediated by them. Now coming to the second part, again related to the receptors. So M1, M2, M3, NM, NN, and NM. So here we'll see what are the agonists and what are the antagonists. Okay, now agonist and antagonist. So agonist at M1 receptor is oxopremorine, and antagonist at M1 receptor is pyrazipine. Then agonist at M2 is methacholine, and antagonist is tryptophan. Then agonist at M3 is bethanechol, and antagonist at M3 is solifenacin, darifenacin. Okay, NN पे agonist is nicotine and DMPP. Antagonist is trimethophan and hexamethonium. NM per agonist is again nicotine and PTMA, and antagonist is D-tubercularic and bungaro toxin. Okay, so these are the various agonist and antagonist on the muscarinic and nicotinic receptors. Right, now coming to the next part of this, that is what are the drugs which are acting through the cholinergic system. So the drugs are divided into two parts: directly acting and indirectly acting. Okay, so let's see the directly acting ones. They are simple. They are pilocarpine, acetylcholine, methacholine, bethanechol, and carbachol. Okay, now what are indirectly acting cholinergic drugs? So indirectly acting mein we have mainly these are acetylcholinesterase inhibitors or anticholinesterase. In this we have reversible and we have irreversible drugs. Okay, so reversible we have some which are lipid soluble and some which are water soluble. Lipid soluble mein we have the first drug, that is physostigmine. Then we have tacrine, donepezil, rivastigmine, and galantamine. Okay, in water soluble we have neostigmine, pyridostigmine, and edrophonium. Okay, now let's come to the irreversible ones. So what are the irreversible ones? Irreversible ones are divided into organophosphates and carbamates. Okay, now carbamates mein we have carbaryl, propoxur. Here OPCs mein we have malathion. These are basically insecticides or pesticides. Malathion, parathion. Then we have diazinon and various nerve gases also, which are irreversibles. So this is the classification of drugs which are cholinergic. Directly acting are these, and indirectly acting are mostly anticholinesterases, and they have reversible and irreversible. In which we have lipid soluble these, and water soluble these. Irreversible we have these drugs. Now let's see some of the characteristics of these drugs. So physostigmine, it is a quaternary compound. Okay, and because of it being a it is a tertiary compound, and because of it being a tertiary amine, it can cross the blood-brain barrier. Okay, so that is first thing. Then it is used in eye in angle closure glaucoma. Physostigmine is used in atropine poisoning. It is the treatment of choice in atropine poisoning, also in belladonna or datura poisoning. Okay, so this is atropine, physostigmine. Then neostigmine, if we talk about neostigmine, this is a quaternary compound, quaternary amine, so it does not cross blood-brain barrier. So neostigmine is basically used in myasthenia gravis. It is used in cobra bite treatment, because cobra bite consists of a toxin which causes muscle paralysis, and it is used to reverse the skeletal muscle relaxant, that is D-tubercularic, right? Then by virtue of its action on muscarinic receptors, it is used in post-operative paralytic ileus and post-operative urinary retention also. Okay, in this, to have the action of neostigmine properly on the myasthenia gravis cobra bite, because these are the nicotinic actions, so sometimes atropine may be added to mask the muscarinic effects. Okay, so these are the uses of neostigmine. Then other cholinesterase drugs are there. So we have donepezil, which is used in Alzheimer's disease, right? In Alzheimer's we also use rivastigmine, and galantamine. They're also used in Alzheimer's disease. Alzheimer's disease is a disease where there is amyloid plaques and neurofibrillary tangles in the basal nucleus of Maynard in the brain. This causes degeneration of cholinergic fibers in the brain, right? So here these drugs are given, which are found to be effective. Other drugs in Alzheimer's disease are NMDA antagonist, which is memantine. Okay, that is also given. Then there's a monoclonal antibody, which is aducanumab. So that is also given in Alzheimer's. Myasthenia gravis का एक detail बताना है, that diagnosis and over treatment by neostigmine. For that we have a test which is called as hydrophonium test. So if you give hydrophonium to the patient and there is a benefit, that is there is an improvement, the muscle weakness improves, then it is myasthenia gravis or myasthenic crisis. But if there is worsening by using hydrophonium, then it is cholinergic crisis. That means there is an overuse of neostigmine, overuse of cholinesterase, anticholinesterase, and that is causing the muscle weakness. This is something which happens paradoxically. Now, some other cholinesterase drug like pilocarpine. Now, pilocarpine is used in open angle glaucoma, okay, as eye drops. It is also used to contract mydriatics. In open angle, it is the third line drug. Remember this, to contract the mydriatics in acute anterior uveitis to prevent the formation of adhesions. इसके side effect होता है that it causes stinging sensation and spasm of accommodation. Okay, so this is the side effect caused by pilocarpine. तो आगे अपन बढ़ते हैं इसमें. तो एक दूसरी ड्रग है methanacol, right? Methanacol is used in the treatment of post-operative urinary retention only. It is not used in post-operative paralytic IS. ठीक है, इसमें नहीं यूज होती है. It is only used in urinary retention. Then there's another drug. Pilocarpine के साथ ही है cevimeline. Pilocarpine and cevimeline, they both are used in dry mouth due to Sjogren's syndrome. Okay, and they are also used in radiation damage of salivary glands, because due to their action as parasympathetic drugs, they will increase the secretions in the mouth, so that will relieve the dry mouth and radiation damage of salivary glands, right? Then pyridostigmine is used same as neostigmine. Okay, hydrophonium, I've told you right now that this is basically a very short acting drug, and so it is used in mainly diagnostic test, and the test is known as tensilon test. Okay, then there is tacrine, which was basically used in Alzheimer's disease but contraindicated now because of hepatotoxicity. And rivastigmine, galantamine we have already seen. Now let's come to the irreversible ones. Now irreversible ones are mainly pesticides or insecticides. Okay, in this we have phosphates and carbamates, right? Now इसमें organophosphates में there's only one drug, ecothiopate, which is used in glaucoma. Rest all are not used. The symptoms are basically extension of the acetylcholine, like there will be pinpoint pupil, there will be excessive secretion, salivation, lacrimation, there will be bradycardia, okay, and there will be hypotension. Slight increase in BP and heart rate may happen, maybe because of stimulation of N receptors, that is receptors present on the ganglion. Now whenever there is a poisoning by OPC compounds, atropine is the antidote, is the drug of choice. It is given every 5 minutes till sign of atropinization seen. And what is that sign? The first sign is dry mouth. Okay, so that is the atropine is the antidote here. Pralidoxime are there. Now pralidoximes basically they are indicated only when there is respiratory depression. Okay, they regenerate acetylcholine in OPC, but they are contraindicated in carbamates. Carbamates में they are totally contraindicated. Please remember this. इसके ऊपर कई बार questions भी आते हैं, and they in fact can increase carbamate poisoning by their own acetylcholine inhibitory action. So they can in fact potentiate carbamate. So they are totally inhibited or contraindicated. Then there is something organophosphates. They undergo aging also, because with time there's a loss of alkyl group, and this can result in a delayed neuropathy because of loss of demyelination, I'll say, and also NTE inhibition, that is neuropathy target esterase inhibition, and they also produce an intermediate syndrome. Okay, so this is the action of organophosphates. Fine. Coming to the oximes में ही एक चीज और थी, that DAM, it can cross the blood-brain barrier also and can cause central effects also. That is diacetyl monoxim, and pralidoxim, which is called as PAM, it does not cross blood-brain barrier. Okay. Now then next we have nicotinic receptors. तो nicotinic receptors पर जो drugs act कर रही हैं, हम यहाँ पे बात कर रहे हैं NN and NM. NM की बात हम बाद में करेंगे. NN receptor पे जो इसका alpha 4 beta 2 subtype है, this basically is present in the neurons of nucleus accumbens and other mesolimbic areas, and they cause dopamine release. Okay, so nicotinic receptor का जो alpha 4 beta 2 subtype है, this is present in this area, and on stimulation it causes dopamine release, and this is the hormone, this is the area responsible for the cigarette smoking addiction. So what are the drugs treatment of smoking cessation? What are the drugs that are there in the market? So we have varenicline, which is a partial agonist at alpha 4 beta 2 receptor. Then we have bupropion, which is an antidepressant, and it inhibits the reuptake of noradrenaline and dopamine. Then we have nicotine chewing gums, lozenges, inhaler and spray, right? And we have nicotine transdermal patch. Nicotine की tablets नहीं होती हैं. There are no nicotine tablets. Sometimes these questions are asked. Then nicotine lozenges have a better absorption because they are 100% absorption than gums, right? And then the nicotine gums should be taken 15 minutes before and after the food. So this was about the cholinergics. Now we come to the anticholinergics. Okay, in anticholinergics, basically anticholinergics are drugs which block the muscarinic and nicotinic receptors. NN पे हम बोलते हैं उनको ganglion blockers, and NM पे हम बोलते हैं उनको neuromuscular blockers. Okay, let's see the classification here. Seen the classification earlier also. Miscellaneous, non-selective and selective. So miscellaneous methods में I had shown you choline uptake inhibitor, that was hemicholinium, right? Vesicular uptake inhibitor, that was besamicol. Then release inhibitor, that was botulinum toxin. Okay, then selective blockers. Selective blockers में we have M1 selective, that is pyrazapine. M2 selective, that is tryptophan. M3 selective, that is solifenacin, darifenacin. Then non-selective, we have atropine, hyoscine, right, or also called as scopolamine. Okay, so these are the anticholinergic drugs. This is the classification of anticholinergic drugs. Now atropine is a non-selective blocker. We have to understand that atropine is a CNS stimulant, while scopolamine is a CNS depressant. Okay, now let's take them one by one. So hyoscine के uses क्या होते हैं? Basically this induces twilight sleep kind of situation. So it is used as a lie detector. Then it is used in motion sickness. Okay, remember one thing, prophylaxis of motion sickness, we use, what is the drug given? That is acetazolamide. Okay, treatment of motion sickness, we use hyoscine. Then there are some drugs which are called as central anticholinergics. This I am sure you will remember. So these central anticholinergics are trihexyphenidyl, then benztropine and biperidine. And these drugs are used in drug-induced Parkinsonism. Okay, they are used there. They are also used in antipsychotic induced extrapyramidal symptoms, right? Then we come to the next drug. What is the next drug here? That is uses in eye. Let's see. Eye में we use hometropine, cyclopentolate and tropicamide. Okay, these drugs are used as mydriatics and cycloplegic. They are used to examine the fundus, and they are used to check the refractive errors. Okay, Out of this, tropicamide is shortest acting, so it is the most preferred. Remember that anticholinergics are contraindicated in glaucoma. Okay, don't use them in glaucoma because they cause mydriasis and then they will increase the intraocular pressure. Coming to the uses in CVS. CVS may initially atropine causes bradycardia, right? This is because of presynaptic inhibition of M2 receptors. But on further use, it causes tachycardia due to inhibition of postsynaptic M2 receptors, right? Another important thing, in bradycardia, we use atropine. Atropine is also used in, if there is AV block, then also we use atropine. So atropine is used as a treatment in bradycardia and AV block. Okay. Next है respiratory system, asthma, COPD. So we have drugs which are ipratropium and tiotropium. These are anticholinergics and they are used in COPD and asthma. Okay. Next, we have glycopyrrolate. This drug is used in pre-anesthetic medication. Okay, this is used in pre-anesthetic medication because it reduces secretions and reflux, bronchospasm during intubation in general anesthesia, right? Then in GIT, what is the action in GIT? It causes reduced motility. Now there is a drug which is pyranzapine. Where is this pyranzapine used? It is used in peptic ulcer because of its action on M1 receptor, right? So this is used in peptic ulcer. Then other drugs which are used in GIT are hyoscine and dicyclomine. Specifically, it is used in colic pain, reduces the spasm. Then next we have GUT, that is genitourinary system. Here again dicyclomine can be used in colicky pain. Dicyclomine, flevoxate and oxybutynine. They are also used in urinary retention. Then we have tolterodine, solifenacin and derifenacin. They are also used in overactive bladder. Okay. Now some specific characteristics related to these drugs. So there's a drug called as trospium, which has got no CNS action, is safe in elderly and also safe with other drugs. Oxybutynine is having maximum dry mouth and is shortest acting. Solifenacin is longest acting. Mirabegron is, there are these two new drugs, mirabegron and vibegron. These are beta-3 adrenergic agonist. They're beta-3 adrenergic agonist. In refractory cases, we use intravesical injection of botulinum toxin also. Okay. Then other uses, coming to the other uses of anticholinergics also in their actions. On glands, they reduce the secretions and they cause dry mouth, right? They cause dry skin and they cause hyperthermia. Okay. Then botulinum toxin A is used in blepharospasm, then strabismus, cervical dystonia and glabular lines. Basically, you know the word Botox. So botulinum toxin is nothing but Botox. Then there is new compound which is onabotulinum. This is used in chronic migraine. Okay. Then there is prabotulinum, which is used in glabular lines. Then there is rimabotulinum, and this is basically used in chronic sialuria. Okay. Now coming to another use of atropine, that is mushroom poisoning. Now mushroom poisoning may remember early poisoning due to INI-CET species. You can use atropine. Okay. So atropine is used in early poisoning due to INI-CET species. It is contraindicated in Amanita muscaria poisoning, and thiotic acid is used in late mushroom poisoning, which is due to Amanita phalloides, right? Okay. Now a few more important points. Atropine is added to diphenoxylate to reduce its addicting potential. This came as a very important question also I think in NEET 2024, right? Then what do you use in atropine poisoning? In atropine poisoning के features क्या होंगे? Atropine हो गया या belladonna हो गया या धतूरा हो गया. इन तीनों में there will be dry skin, dry mouth, then dilated pupil, hyperthermia, then tachycardia and urinary retention, right? So in all these things, what is the drug that we use for treatment? We use physostigmine. Okay, so with this we come to an end of the cholinergic and anticholinergics. Tomorrow we'll look after the adrenergic and antiadrenergics. Okay.